My God, I hate trucks.
May have been a sharp decline in firework-related injuries, but pollution caused by the revelry still took a turn for the worse. Carolyn Bonkin tells us more.
The sky is clear in San Juan City in the afternoon of January 1, but earlier at 3 a.m., the quality of air monitored here was unhealthy. Levels returned to fair quality at 6 a.m. The Environmental Management Bureau says, despite the apparent decline in the use of firecrackers due to less reported injuries, the air remains heavily polluted as Metro Manila welcomed the new year, especially between midnight to 4 a.m.
Malalaki ang ginagamit siguro nilang mga fireworks.
In Pasay, for example, the air quality monitored at the PAO compound by 4 p.m. of December 31st was good. But 3 hours into the new year, it became hazardous. Aside from airplanes and vehicles coming in and out of the airport, the EMB says firework displays contributed to the pollution.
Posible na ang mga contribution ng ating pag-spike ng mga readings natin based doon sa ating mga monitoring stations ay doon sa fireworks. Aside from other air pollution sources like yung mga vehicle, pero sa nakikita namin nung nag-spike na yung ibang stations ang reading, doon yun nag-emanate sa mga putukan sa fireworks.
By 3 a.m., air quality levels in North Caloocan and Muntinlupa were unhealthy for sensitive groups. In Parañaque, it ranged from very unhealthy to hazardous. In Pasig, very unhealthy.
The Environmental Management Bureau says it may take 3 to 6 months to clear the air of firecracker smoke particles. But as Metro Manila begins the daily grind after the holidays, there won't be as much difference as emission from thousands of vehicles will add up to the heavily polluted air.
The EMB warns the poor air quality may trigger lung and health problems. Those living or traveling in areas with poor air quality are advised to take extra precautions, to use masks or any nose covers, and to avoid major streets with heavy traffic. These warnings are especially for those who have existing respiratory problems.
Yung mga asthmatic, yung meron ng, yung iba naman hindi naman talaga hereditary na nagiging asthmatic sila, nakukuha lang nila, na-acquire lang nila yan because of yung klaseng hangin.
For now, the EMB is still promoting a more permanent solution to pollution, to plant more trees and replace old vehicles. Carolyn Bonkin, CNN Philippines.
Heads up, motorists, you will pay more for fuel at the beginning of the new year because of an additional excise tax. Under the tax reform for acceleration and inclusion or train law, an additional 2 pesos per liter excise tax is imposed on diesel and gasoline, 1 peso for every liter of kerosene, and another peso for every kilogram of liquefied petroleum gas or LPG. But even if this takes effect today, it should not cause pump prices to shoot up immediately. The Energy Department earlier told oil companies to clear their 2018 inventories first before charging the additional tax. Violators may face penalties such as closure and large-scale estafa charges. Meanwhile, an estimated 7 million senior citizens across the country stand to benefit from additional discounts on medicines for hypertension, high cholesterol, and diabetes. Health Secretary Francisco Duque says under the same tax reform law, maintenance medicines for those illnesses are exempt from the 12% value-added tax beginning today. Adding this to the current 20% discount brings the seniors' discount on these medicines to 32%.
Karamihan dyan mga senior citizens. So 7 million at the most, yan ang market niya na maapektuhan positively.
The death toll from tropical depression Usman rises. Disaster risk reduction officials recorded at least 75 casualties, while over 45,000 families are affected in the aftermath of Usman, which hit the country last week. Officials add they are still verifying data from the regions. Sorsogon, Camarines Norte, 8 towns in Oriental Mindoro, Camarines Sur, and Albay are under a state of calamity. This will allow for a faster release of relief funds. In Laguna, a cleanup is underway after some residents welcomed the new year amid flood waters. Our Trisha Terada spoke to some of those affected.
A number of residents in Calamba, Laguna ended 2018 wading in flood waters from heavy rains. Cars and people could hardly cross roads in portions of the city because of ankle to almost waist-high mud waters. So on the first day of the new year, Emeterio Pantoja cleans up his house in waist-deep flood.
Ay hindi ho kami nakapagwan. Paghanda-handa at gayon nga inabot na ho ng baha.
Pantoja is no stranger to floods, so he knows what to do.
Umpisa pa lang ho ng ulan, hindi ang aming mga gamit ito inilagay na namin sa tub para pagka binuha to, maluwan lang. Buhat lang ho ng buhat.
Mercy Cabi also had to close her bake shop at a time of brisk sales.
Bukod sa imbis na may pagsasalo-saluhan, hindi makakapamalingke kasi inuna namin yung mga gamit paghakot. Pero sanay na kami.
Barangay officers and quick response teams were on standby at the height of then tropical depression Usman before it was downgraded to an LPA.
Tinutukan namin lahat yun. Miski gabi, tinututukan namin yun. Mga tao, pinalilikas namin lahat.
In Purok Uno in Parian, Calamba, almost 200 residents evacuated, but they were quick to recover. They're back in their homes as soon as the flood receded, leaving some of their things in safe grounds.
Ito yung mga gamit na hinakot, yan, para hindi mabasa. Kasi last year, na kami, dala na mahirap maglaba.
Residents say they're just thankful to be safe in 2019. It was more than they can ask for in the new year. Trisha Tarada, CNN Philippines.
It's a good start for 2019, at least for the government's anti-illegal fireworks campaign. Senior correspondent Ina Andalong tells us the number of fireworks-related injuries hit a record low.
It's the biggest drop in the number of firecracker-related injuries ever. 68%, covering December 21, 2018 to 6 a.m. of January 1, 2019. From 428 last year, this number is down to 139. Officials attribute this to the ban on firecrackers in households and the rainy weather. Data on firecracker-related injuries will be gathered until January 5th.
We also expect cases to increase as there are late reports still coming from other regions. Most additional injuries during this time may arise from children picking up unexploded fireworks in the streets.
Metro Manila continues to have the most number of cases, followed by Western Visayas, Central Visayas, Central Luzon, and Calabarzon. Firecrackers causing most injuries: Quitis, Boga, Piccolo, Lucis, 5-Star, and Triangle. All of them illegal.
Pero yung mga bawal po, talagang kalimitan naman yan underground. Pero yan pa rin po ang ating ikinakandak ng na hulihin sila.
There were 2 cases of firecracker ingestion, no stray bullet case stemming from the revelries, and no reported deaths. 2 injuries happened at designated display areas, one in Batangas City and the other in Santa Ana, Manila. Health Secretary Francisco Duque says these will be investigated as he suspects the displays weren't properly managed. To avoid all these injuries altogether, the Health Department is batting for a total ban on fireworks, but only when alternative livelihood programs are offered to workers who may be affected. Though firecracker-related injuries are down, officials say they continue to monitor an uptick, common at this time of the year, in the number of people who are rushed to the ER for conditions like hypertension, stroke, and gastroenteritis because of overeating or alcohol binging.
Ang number 1 kalaban ng tao dito, kalabisan.
Ina Andalong, CNN Philippines.
The first day of 2019 is almost over. Let's see if more people are checking into hospitals with firework-related injuries. Rex Media joins us live from the East Avenue Medical Center in Quezon City. Rex, what are the latest figures there?
So far, we only have a dozen fireworks-related injuries at the East Avenue Medical Center. A 7-year-old child who came here at 2 in the afternoon was the last firecracker victim. The good news is that all of them only obtained minor injuries and all were already sent home. And their first-degree burns were immediately treated. There was no need for them to be confined. Doctors even had to stow away medical tools like saws unused. The victims' ages range from 2 to 65. Injuries were caused by quitis and whistle bombs. The number of such injuries at the East Avenue Medical Center was cut to half compared to last year's 24 cases. At the Jose Reyes Memorial Medical Center in Manila, the trend was the same, also lower by half than last year's. Since December 21, they only have 24 cases now compared to the 57 cases in the same period last year. Most cases are caused by looses and whistle bomb. Unfortunately, 2 of them have to be amputated. But still, the number of injuries at these hospitals are possibly their lowest in many years. The main reasons, first, the continuous rains which prevented people from going outdoors. Also, officials are crediting better preparations of the health department. This includes information campaigns, including showing of gory photos of amputated hands. Both hospitals have 100 doctors and the same number of nurses each to cater to victims if in case the number spikes in the coming days. Pia.
Extra media there, reporting live from the East Avenue Medical Center in Quezon City.